Already the counties of Kisumu, Machakos, Isiolo, and Nyeri have been identified for a 100% pilot on universal health coverage. The pilot is important because it allows the government, the national government, and the county governments to assess the efficiency and effectiveness of facilities and institutions that are key to delivery. Health Cabinet Secretary Cicely Kariuki is going to Cuba in this week. She is going to close on key agreements critical to the President's agenda to reduce common illnesses such as malaria. In collaboration with Cuba, the government expects to launch this year a malaria vector control project in the counties of Busia, Kakamega, Bungoma, Siaya, Kisumu, Migori, Homa Bay, Kisii, and Nyamira, which, as you know, some of those that are worst affected by malaria in our country. You have heard plenty about Cuban doctors, including the opposition to them by our doctors' unions. The plan is very much still to bring 100 Cuban specialists in areas such as oncology, nephrology, and dermatology.